Hi, I'm Eric, co-founder of Delos Therapy, and I'm with Megan. She's going to be our assistant today. So we're going to be talking about hip tightness. A lot of patients experience hip tightness. It's one of the more common conditions that we see in our clinic. So hips can hurt in the posterior side, lateral side, medial side, even in the hip flexors. So it can come in a variety of locations. What we'll be discussing today is what causes hips to become tight and what to be on the lookout for and what you can do on your own to help with that. So the basis of our therapy is really to restore pliability. So what you'll notice around any area that hurts or feels stiff is the muscles become rock hard. A muscle should never be hard. This is my example that I go to. A muscle should always be soft and spongy. So around an area of your hip that feels tight, it's causing pain, whether that pain is sharp or dull, what you'll notice around that area is the muscles have a tendency to be very hard and chronically contracted in that area. The three most common things I hear all day in the clinic for patients trying to get rid of that: stretching, foam rolling, and massage. In my opinion, those things have very limited benefits to actually breaking apart that tightness. So what we'll be discussing today is how to actually break up that tightness with pressure. We do that in the clinic, but I want to teach you guys how to do it with a simple tool called a Knobble. So what we'll have Megan do is find an area that typically feels tight, that again feels harder, or might even feel tender to the touch. Those are the areas that need work. There's some pathology happening in that tissue, some inflammation happening in that tissue that needs to be flushed with fresh blood. So we're going to be going directly into that area. So find an area in your hip, in the back side of your hip. Let's start through here. So you just want to lift up. And the key with using the Knobble is to hold pressure for 2 or 3 seconds. That pressure should be static. You shouldn't be moving around. It's not a massage technique. If you're moving around, you're dispersing the pressure away from the muscle. All of that force has to go directly into that muscle, forcing the tissue to stretch and separate at the location of the pressure. It will feel tender. That's okay. The amount of pressure is important. Too little pressure, it doesn't change structure. We have to change structure. But too much pressure will cause you to guard. So I see you're grimacing a little bit. So it should be a pressure that hurts so good. So that's something that I commonly hear, is that this hurts so good, it feels therapeutic. That's where you want to be. Too little than that, it doesn't really change structure. If you go past that, then it'll cause you to tighten up. And if you think about it, if you're tightening and trying to loosen at the same time, those are opposing forces. So it should feel good. You should hold pressure 2 to 3 seconds. And you want to use something what I call the grid format. So if you just sort of draw a box around the tightness and just go up and down one area, left and right, to cover everything. You want to cover as much tissue as you can. The more surface area that you're loosening up, the more pliability you're restoring to the muscle, the better overall function you'll get. And keep in mind, muscles should not be tender when you press into them. So if they are tender, then that's an indication that you need to get fresh blood into that area. You have to flush away the lactic acid that's irritating the neurological system in that area, and that's actually what's causing the pain. So flushing that away with pressure is a great way to dampen the neurological system, loosen up the muscle tissue, get more muscle activation. You'll get stronger, you'll have more range of motion, more flexibility, and overall you'll feel better.
And if I'm in a small grid right along where I am on my hip, how long do I just spend going up and down that grid?
So I would say try to get through everything twice. So that's something that we do in the clinic. We call that the 2-pass method. So if you have your grid and you go back and forth, up and down, try to get through all of that 2 times. What you want to notice is the first pass, everything is pretty sensitive and everything feels pretty tight. If you've done it effectively, what you'll notice is that second pass, sensitivity has gone down and the muscle tissue is a lot softer, so it's a lot more pliable. So I would say do that at least twice, if not 3 times, and that should be sufficient for that round to take a break, potentially ice the area, 20 minutes on, 20 minutes off, to decrease any of the soreness associated with therapy. And you also want to do both sides. So I would say once you do 2 passes on one side of the hip, switch over to the other and follow the exact same regimen. You want to do everything bilaterally. Just because you have pain on one side doesn't mean the other side isn't tight. Very common progression that I hear is that it starts on one side and progresses to both. I would say most of the patients I see come in with one knee that hurts, one shoulder, one hip. It's rarely both sides at exactly the same time. Just like you have a dominant side or a stronger side, everybody has a tighter side. And it does not correspond to handedness. Just because you're right-handed doesn't mean your left hip cannot hurt or your left shoulder. And you can experiment with different positions in the sense right now you're kind of just coming directly posterior, but you could also, what we call doing pre-stretches. Think about muscles so that's a great angle right there. Muscles are three-dimensional, so they need to be loosened up three-dimensionally. So you don't want to just apply pressure in one angle, you want to apply pressure in multiple angles, but also reorient the muscle in different orientations, because as soon as you change the orientation of the muscle, even if you're applying pressure in the exact same location, in the exact same angle, it's different.
It does feel different.
Yeah.
Even just crossing one leg over the other.
If you're working on the glutes, very complicated. It's a very complicated area with multiple layers of muscle tissue. There's a group of 6 muscles that are below the exterior glute muscle called the glute maximus. Those muscles are typically difficult to access. Piriformis is the most common muscle of that group. So to access it, sometimes you have to manipulate the hip, manipulate the leg to kind of pull that tissue out of the way so that you can get access to it. Because if you're pushing on the wrong muscles that are pliable but not necessarily the culprit, or they're covering the tight areas and you're never touching or accessing the tight areas, you won't respond, you won't get better.
And how often do you recommend working on one particular area?
It depends on how active you are. So someone that's doing high intensity interval training 7 days a week, they're going to need more therapy, more pliability training versus someone that's not very active. So there are many, many variables. There are genetics, there's diet, there's lifestyle, there's activity, age. All of those things are variables to think about, but I would say at least a couple times a week, or if not every day for 10 minutes, I think would provide drastic changes to your muscles. Your muscles have to remain pliable. You brush your teeth every day, you shower every day, you have to take care of your muscles. So now let's change angles a little bit. So we're still going to be working on the posterior side of the glute and a little bit of the lateral side, but I want you to get on your side. So now, so you can think about the posterior glute, and we were coming in directly into it. Now we're positioning our body on the side. So you're still hitting some of the same muscle tissue, but now you're coming in at an angle. So again, if you think about the three-dimensionality of tightness coming at an angle, what you'll notice right away is that some areas are far more tender than others. If it's more tender, that's an area you need to spend a little bit more time on. Muscles should not be tender with pressure. So if it feels tender, work that area. How does that feel?
It's definitely tender.
Yeah.
Definitely tender.
So the great thing about the Knobble is it's pretty easy to just put body weight. Right? So body weight is usually enough to force that stretch. Lacrosse ball is something else you can use. Some patients use golf balls or tennis balls. Tennis balls are typically a little bit too soft, so you need some resistance to force that stretch. If it's too soft, you won't get that resistance. But it also should be concentrated pressure, so if it's too big, then it's more of a compression. A compression does not stretch apart tissue. But if it's too concentrated, then it'll hurt. And if it hurts so much that you can't do it, it's not effective. So it's the right amount of sharpness versus broadness versus hardness that factor in a useful tool. And that's one reason why the Knobble was developed, is because the engineers behind it understood that you have to stretch apart a muscle with pressure with the right surface and the right surface area. And it's funny how often I hear patients say they're doing physical therapy, they're doing yoga, Pilates, they're stretching, they're foam rolling, they're getting deep tissue massages, they're trying all these things, they're not getting better, they don't understand why, and they say, the only thing that helps is when I go home and I grab a lacrosse ball and I dig it into my back, or I dig it into my glute, and I stop them right there, and I say, well, what's different? What's different about the lacrosse ball versus everything else that you're doing? You're applying pressure. Applying pressure is by far the most effective way to stretch tightness. So everything else that particular patient's doing, although effective in its own way, isn't breaking apart the tightness. Because once you break apart the tightness, now things can actually move. So that's when stretching, yoga, Pilates become effective. That's when strength training become effective. Because if you think about tightness, it can't move apart. So stretching, yoga, Pilates won't work, but it can't contract. So strength training doesn't work. So when you break up that tightness, it can move in both directions. So good, make sure we're doing both sides. So now we're working on a little bit of the lateral hip. So I would say lateral and posterior hips are one of the more common things that we see. So it could be anyone that does a lot of running, so hip flexors for sure, lateral hips, people that do a lot of jumps, lateral movements, so tennis players, table tennis players, soccer players, that's going to affect the lateral hips. People that are doing high intensity interval training, so they're really doing a variety of exercises, so you have to be on guard for tightness in pretty much anywhere in the hips with that. But repetitive movement is what causes an area to get tight. So a lot of patients will say, well, why is it the front of my hips, or why is it the back of my hips, or why is it the side of the hips? It all depends on muscle recruitment. Whatever muscles you're using repetitively, those are the ones that are going to get tight. So in addition to genetics, right? So all things being equal, someone might have genes that cause hip flexors to get tight versus the posterior side of their hips to get tight. So there are many, many variables to think about, but in general, as a general rule, you can think of the more you use one particular area, the tighter it will get. And the more therapy it will need. All right, so we've loosened up both sides. So again, you can do what's called a self-pliability test, so you can kind of feel the areas. What you want to notice is that there's some change in the texture of the muscle. So again, everything should be very soft and pliable. When you start, the areas will be tender, and they can be a little bit tough to the touch. They will feel hard. What you want to notice over time as you're treating the areas that the sensitivity is decreasing, and when you apply pressure, it doesn't feel as hard. You might get a sense of warmth, that's blood flow in the area. Those are all great signs. So this is actually a great way to warm up the area. It's a great way to restore pliability to the area and restore function to the area. All that sound good?
Great. Yeah.
Well, thank you, Megan. Appreciate your assistance.